welcome back. 17 on set. We're talking this whole month about breast cancer awareness because it is October. And Dr. Ravi Patel from the Comprehensive Blood and Cancer Center is joining us with some updates on treatments and also some clinical trials going on right now here in Bakersfield. Very exciting. Dr. Patel, good morning. Great to have you in.
Andy.
This is so cool. Bakersfield being, part of making the future of medicine and changing the way treatment is done for cancer patients. Tell us about this new clinical trial.
So we're doing this new clinical trial with UCLA, and it's an interesting trial because cancer cells, one of the unique things cancer cells have is that they cannot be killed because they have the ability to continuously repair themselves. So this particular drug prevents these cancer cells from repairing themselves so we can destroy them. And the fortunate thing is it doesn't affect a lot of the normal cells or affects them minimally. So it's does not have the traditional side effects of hair loss. So it's a clinical trial, very, very good for patients with breast cancer who have the mutation called BRCA1 and 2. Also can be used for certain kinds of other cancers where they have what is called triple negative breast cancer, and other cancers, lung cancer, pancreatic cancer, where they've exhausted normal treatment.
That's exciting. And then we're also talking about breast cancer treatment. And this is something I kind of called when we were talking about it, the Angelina Jolie effect,
yes.
Where a lot of cancer patients, breast cancer patients, assume they need a mastectomy right
yes.
away and that is necessary for treatment.
Yes, the knee-jerk reaction is, I've got cancer, I got to get rid of both the breasts and then I'll never get it back. Not always true. And you can get equally good results just with a lumpectomy. And recently there's been data that patients who undergo mastectomy, reconstruction, have higher risk of complications than to just go through a lumpectomy, which is a lot easier on them, and they get very good results.
And how is it that can be just as good of a treatment? What do you do instead along with the lumpectomy?
Very good question. I think you're going to put us out of business. But the thing is that breast cancer, the surgery is not the only solution. They have to get some other treatment which works everywhere and eradicates the cancer.
Okay. And then tell us about precision medicine for breast cancer treatment.
Very interesting, because precision medicine is the ability to understand how the cancer is, what is the genetic makeup of the cancer, what drives the cancer, and then target and tailor the treatment according to the genetic makeup, according to the chemical nature of the cancer, according to the understanding of how much of the chemical nature of the cancer has certain targets you can use, and then selecting the medicines according to that, rather than just throwing the bomb and hoping everybody will be attacked,
Not everyone has the same type of cancer or breast cancer.
Exactly. Everybody can have the same size of cancer, but each one could be very unique. One could be extremely slow growing, one could be extremely aggressive, and it's very important to understand which one it is to tailor the treatment.
All right, and this is, of course, a very important topic this month. We want to encourage all women to get their screenings, to make sure they're doing their self-exams, and get the mammograms if you're of that age, and just be aware of your body.
Be totally aware of your body, and there are more people alive with cancer than have died. Remember that.
That is a wonderful thing to remember. We want to celebrate all survivors this month of breast cancer. Dr. Ravi Patel, thanks so much for coming in this morning. We appreciate it. Always great to have you and hear about these exciting advances.
Thank you.
We're right back after this.